Low blood pressure in older people can be a real problem. Of course, it can be a real problem in younger people as well, but it is not as common as it is in the older population. Part of the problem is that a lot of times when older people go to see the doctor, they have to do some of the most painful things that they do in a given day in just a very contracted period of time. So just the fact that someone has to get in the car, go to the doctor, go from the waiting room to the examination room, and as soon as they have walked whatever that distance is and climbed on top of the exam table, which is probably more than they do in an average day, their blood pressure shoots up. And they also feel the pain of getting up out of a chair into an exam table and so on. And so this, for many people, produces a falsely elevated blood pressure when they're getting their blood pressure taken in the doctor's office. As a result of that, many people who are older and more debilitated are overly treated for blood pressure. That means they had a normal blood pressure when they were home being left alone. They got up, went to the doctor's office. In the act of doing so, they exacerbated the pain in their hip and their knee and their shoulders and whatever, and that raised their blood pressure. Or they were just excited to be at the doctor because they were always healthy. They never had to go to the doctor until the day that they turned 65 or something like that. And the problem with having low blood pressure is that the blood pressure that your heart produces when it beats is meant to go through and supply your entire body, including your brain. And you see there's gravity that's fighting this direction of flow. So usually the brain is the first place that suffers the effects of low blood pressure. And low diastolic blood pressure, which is the bottom number, normally should have a low end minimum of 60. Blood pressure less than 60 does not allow the blood flow to the brain to continue normally, so that even if your brain is completely normal, the blood vessels in your brain are completely normal, you can look demented simply because your blood pressure is 90/40. There is simply not enough blood pressure to get the oxygen into your tiny little arteries in your brain, and people look like they have dementia, but then you take them off of their blood pressure medications and they look normal. Now, I'm not saying that older people shouldn't take blood pressure. No, actually, they're probably the highest risk for suffering the problems from high blood pressure. But I think that what we need to do is to make sure that we measure blood pressure in the person's own setting, when they're not being excited, when we're not doing things that exacerbate their pain, and then decide whether they need blood pressure treatment or not.